Imagine your newborn baby being diagnosed with an extremely rare bone disease, then being in a race against time, waiting for a life-saving bone marrow match for your child. Well, that's exactly what happened to my next guests. With us today are Paul and Barbara Wersten, and also joining us is one of the experts on this disease, Dr. Paul Orchard. Good morning.
Good morning.
Thank you so much for being with me.
Thanks for having us.
Barbara, let me start with you, and Paul. What happened with Ryan? Tell me what happened when he was born.
So it was a normal pregnancy, a normal delivery, and shortly after he was born, he was put into the NICU for being jaundiced.
Okay.
And during that time, they just run a panel of blood work just as part of the process of being in the NICU. And it kept coming back that his calcium was low, and the doctors didn't know why. So after about a week and a half, we had him transferred to another teaching hospital, and it was there that, between all the experts in all the facets of the hospital, he was diagnosed with malignant infantile osteopetrosis.
And Paul, did you even know what that was, and were you so confused at that moment trying to figure out, what is this?
By that point, the information we had been given was pray that it's not malignant infantile osteopetrosis. So we knew that the diagnosis was not a good one. We knew that there were two courses of action. They basically told us you could take Ryan home and live through the inevitable, or you could put him through a bone marrow transplant.
And let's talk about that bone marrow transplant, because I know it wasn't easy.
He was a fighter, and he went through the bone marrow transplant, and he spent a month in the ICU at Boston Children's Hospital fighting for his life every day. And we were told many times that this is it. And then he'd fight, and he'd come around again, and he was known as the miracle baby in the hospital.
Did he ever get out of the hospital, Paul?
Ultimately, yes, we had the second best Christmas gift ever when we were able to take him home on Christmas Eve.
Oh.
It was an awesome Christmas morning to be able to pick him up out of a crib in our own living room, as opposed to out of a hospital bed.
And what happened after Christmas?
Because of the bone marrow transplant, your immune system is wiped out. So he wound up getting an infection. We spent several days in our local hospital, and then he got a little stronger again, and then he got another infection, which ultimately wound up taking his life.
I can't imagine your pain. How did you survive that?
I think really we leaned on our faith largest, and each other, and had to accept a new normal.
Doctor, let me bring you in. What is this disease? What did Ryan have?
Ryan had severe malignant osteopetrosis, or SMO. It's also known as malignant infantile osteopetrosis, or MIOP. It's a rare inherited bone disease. We don't ordinarily think of bone as being a dynamic tissue, but it really is. So there's cells that are making bone, there's cells that are taking bone away. And so that's how bone is remodeled, and we grow, and bones assume their normal shape. The cells that take bone away are called osteoclasts, and in this disease, those cells don't work. You have an imbalance of bone density. You make bone, but you can't take it away. The bones become very dense and very hard, and they're easy to fracture. And one of the most important pieces is that the bone marrow cavity, which is where you make all your blood, isn't created because the cells can't do that. And so most of these children run into problems with not being able to make blood cells. And so most of the babies die, actually, by the time they're 10 or so.
Pretty rare, doctor?
It's a very rare disease, so it's about 1 in 200,000 babies are born with osteopetrosis every year.
Is it hereditary?
It is. So it's a recessive disease, meaning the parents are carriers, and they would have no way of knowing that they're carriers for the disease. There's a 1 in 4 chance that any baby born to a couple that are carriers for osteopetrosis would have a baby with the disease.
Doctor, I want to talk more about the disease, so we'll be coming back in just a few moments to learn more about this rare disease, which is so critical to bring awareness to this morning, so stay with us. Welcome back to The Balancing Act. We're rejoined by a remarkable couple, Paul and Barbara Wersten, who just shared their story of their son, Ryan, who fought to survive a rare disease but passed away at 6 months old. Also joining me again is Dr. Paul Orchard, one of the foremost experts on this rare disease. Doctor, let's talk a little bit more about this disease. Diagnosis must be so important, and getting that diagnosis quick as well. Is it?
Absolutely. So, Olga, if we have a diagnosis earlier, as a bone marrow transplant specialist, it helps us be more effective in terms of getting the transplant done. It also helps minimize the complications, because a number of these children are affected by the disease in ways that are irreversible. So, for instance, the overgrowth of the bone can affect the nerves, and a lot of the children end up being blind very early in life. Some of them lose their hearing. And those things, even if transplant works well, you don't get those things back.
And once you do that, doctor, is there treatment available today that could help delay the disease progression?
Well, Olga, the definitive therapy is still bone marrow transplantation. However, there is a drug that's FDA approved to delay the time to disease progression in patients with severe malignant osteopetrosis. It's called Interferon Gamma-1b, or ACTIMMUNE. So it may be that the use of interferon in association with bone marrow transplant is going to make therapy more effective. It really hasn't been studied at this point. It's something we're very interested in doing.
What about side effects?
Well, the patients that are older and can describe what they're experiencing describe flu-like symptoms. So sometimes there's fevers, muscle aches, those types of things. Patients that have neurologic problems, cardiac problems, may have difficulties with the drug as well. And in the babies, we follow liver function tests to make sure that there aren't any issues there.
Barbara, I want to bring it back in. I know he fought so hard, and I know you continue to remember him every day through a wonderful foundation that you started. Can you talk to us about that and share maybe how that has helped you get through this?
We've started the Ryan Wersten MIOP Foundation in Ryan's memory, and it is a way for us to fight to keep his memory alive. We have partnered with Dr. Orchard, as well as helping some families who need some financial assistance while they're going through the bone marrow transplant process.
And I also want to share with our viewers another joy that you have in your life. You adopted an 8-month-old baby. His name is Alex.
That's right.
How old is Alex today?
He's 7 years old, and he's a wonderful, amazing child. So he's from Kazakhstan, and we just love him to pieces.
He's a thrill ride at heart, and he loves his big brother and loves to talk about him at,
you do talk
at our
about
annual
Ryan?
fundraisers. We do.
We sure do, and he talks about him daily, about his big brother, and that he can't wait to meet him again.
Thank you so much for sharing your story. God bless both of you and Alex. Doctor, thank you so much for bringing this to our awareness this morning. Do appreciate your time.
Absolutely.
You can log on to curemiop.org, compassforpatients.com, actimmune.com, and of course thebalancing act.com for more information on today's segment.